Don't ignore low energy after 75. It could signal a hidden health problem. While aging affects everyone differently, persistent fatigue is never a diagnosis by itself. It's a symptom that deserves an explanation. Point 1. Persistent fatigue always has a cause, even if it's not immediately obvious. Point 2. The key is finding out what's behind the symptom. Point 3. Some causes are minor, while others may require prompt medical attention. Point 4. That's why ongoing fatigue should never be ignored. Point 5. One of the most common causes of persistent fatigue in older adults is anemia. This condition occurs when your body does not have enough healthy red blood cells or enough hemoglobin to carry oxygen efficiently throughout the body. Without adequate oxygen, your muscles, brain and other organs must work harder, leaving you feeling weak, tired, or short of breath. Some people also notice dizziness, pale skin, cold hands and feet, or a faster heartbeat. Because anemia can develop gradually, many older adults mistake these symptoms for normal aging. Fortunately, a simple blood test can usually identify anemia, and treatment depends on its underlying cause, which may include iron deficiency, vitamin deficiencies, chronic disease, or blood loss. Point 6. Heart disease is another important cause of ongoing fatigue. After the age of 75, when the heart cannot pump blood as effectively as it should, less oxygen and fewer nutrients reach the muscles and vital organs. As a result, even simple activities such as getting dressed, walking to the mailbox, or climbing a few steps may leave you unusually exhausted. Some people also experience shortness of breath, swelling in the ankles or legs, dizziness or chest discomfort, while others may notice fatigue as one of the earliest symptoms because heart disease becomes more common with age. Persistent tiredness should be discussed with a healthcare professional, especially if it appears suddenly or continues to worsen. Point 7. An underactive thyroid, known as hypothyroidism, can also reduce your energy levels. The thyroid gland produces hormones that regulate how your body uses energy. When hormone levels become too low, many body functions begin to slow down. In addition to persistent fatigue, you may notice feeling cold more often than others, unexplained weight gain, constipation, dry skin, muscle weakness, or slow thinking. Since these symptoms often develop gradually, they can easily be mistaken for normal aging. Fortunately, hypothyroidism can usually be diagnosed through blood tests, and appropriate treatment often helps improve energy and overall well-being. Point 8. Diabetes is another condition that may cause constant fatigue. When blood sugar levels remain too high or too low, your body cells cannot use glucose efficiently for energy. This leaves many people feeling tired, even after getting enough sleep. Other warning signs may include increased thirst, frequent urination, blurred vision, slow healing, cuts, numbness in the hands or feet, or unexplained weight changes. Managing blood sugar through healthy eating, physical activity when appropriate, prescribed medication, and regular medical follow-up can often improve both energy levels and long-term health. Point 9. Sometimes the cause of fatigue is not a disease, but a medication. Older adults often take several prescriptions and certain medicines, including some used for high blood pressure, allergies, anxiety, depression, pain, or sleep disorders, may cause drowsiness or reduced energy. As a side effect, taking multiple medications together can sometimes increase these effects. Never stop, reduce, or replace a prescribed medication without consulting your healthcare provider. Instead, discuss any ongoing fatigue during your next appointment, as your treatment plan may be adjusted safely if needed. Point 10. Dehydration is surprisingly common in older adults. Because the natural sensation of thirst becomes weaker with age, some people may not realize they need more fluids until dehydration has already developed. Even mild dehydration can reduce blood volume, making it harder for the heart to deliver oxygen. Throughout the body, this can lead to fatigue, dizziness, headaches, dry mouth, confusion, or even an increased risk of falls. Drinking enough fluids regularly is important for most people, although those with certain heart or kidney conditions should always follow their healthcare providers' recommendations regarding fluid intake. Point 11. Poor nutrition can also quietly drain your energy. Over time, as people age, appetite may decrease, chewing or swallowing may become more difficult, or certain medical conditions may interfere with nutrient absorption. Not getting enough protein, iron, Vitamin B12 folate, or other essential nutrients, can contribute to weakness and fatigue. In addition, losing muscle mass with age can make everyday activities feel more tiring. Eating balanced meals that include adequate protein, fruits, vegetables, whole grains, and healthy fats, and discussing any concerns with a healthcare professional or registered dietitian can help support healthy energy levels. Point 12. Sleep quality is just as important as sleep duration. Conditions such as sleep apnea, restless leg syndrome, chronic pain, or frequent nighttime urination can interrupt sleep, repeatedly leaving you feeling exhausted during the day, even if you spend enough hours in bed. Point 13. If fatigue lasts for several weeks, becomes worse over time, or is accompanied by symptoms such as chest pain, shortness of breath, fainting, unexplained weight loss, confusion, or persistent dizziness, it's important to seek medical evaluation promptly, rather than assuming it's simply part of aging. Point 14. The good news is that many causes of persistent fatigue can be identified and treated. The sooner the underlying problem is found, the sooner appropriate treatment can begin, which may improve both your energy and your overall quality of life. Point 15. Listen to your body. Low energy after 75 should never be ignored. Point 12. Chronic kidney disease can also cause ongoing fatigue, especially in older adults. When the kidneys do not work properly, waste products and excess fluid can build up in the body. The kidneys also produce a hormone that helps make red blood cells, so reduced kidney function may contribute to anemia as well. Fatigue may develop alongside swelling in the feet or ankles, changes in urination, poor appetite, muscle cramps, or trouble concentrating. Because early kidney disease often has few noticeable symptoms, regular medical checkups and blood tests become increasingly important with age. Point 13. Depression is another possible cause of low energy, and it is often overlooked in older adults. Unlike temporary sadness, depression can affect both emotional and physical health. Some people lose interest in activities they once enjoyed, while others notice constant fatigue, changes in sleep, poor appetite, difficulty concentrating, or feelings of hopelessness. Depression is a medical condition, not a normal part of aging, and effective treatments, including counseling, lifestyle changes, and medication, when appropriate, are available through qualified healthcare professionals. Point 14. Chronic infections or inflammatory conditions may also leave you feeling exhausted. Even infections that develop slowly, such as urinary tract infections in some older adults, may present with fatigue, confusion, or weakness. Instead of the typical symptoms seen in younger people, autoimmune diseases and long-term inflammatory disorders can also increase the body's energy demands, making everyday tasks feel much more difficult. Persistent fatigue combined with fever, unexplained pain, or ongoing inflammation should always be evaluated by a healthcare provider. Point 15. Vitamin B12 deficiency becomes more common with age because the body may absorb this vitamin less efficiently over time. Vitamin B12 plays an essential role in producing healthy red blood cells and maintaining proper nerve function. Low levels may cause persistent fatigue, weakness, numbness or tingling in the hands and feet, balance problems, memory difficulties, or mood changes. Since these symptoms often develop gradually, they can easily be overlooked. Blood tests can diagnose the deficiency, and treatment depends on its cause.